Today's Grand Rounds lecture, Dr. David Johnson will be giving. The title is "Breathing Life into Dreams." Dr. Johnson does not need any introduction, so I'm still going to try to do some. He has been here, part of the medical school faculty and community for many years. He is a fabulous academic gastroenterologist and really has done lots of great things throughout his career. I'm going to just touch upon a few of them. Saying again, it is my great pleasure to introduce Dr. David Johnson, a distinguished leader in gastroenterology and a professor of medicine, as well as chief of Division of Gastroenterology here at Eastern Virginia Medical School. Dr. Johnson's career has been marked by an outstanding dedication to clinical practice, education, and research. With over 700 published chapters, articles, reviews, as well as numerous books that he edited and co-edited, Dr. Johnson has made significant contributions to the field of gastroenterology and internal medicine. His expertise spans across esophageal reflux, gut microbiome, sleep disorders, colorectal cancer screening, and his work has been instrumental in advancing our understanding and management of these conditions. Dr. Johnson has held numerous leadership roles, including serving as past president of American College of Gastroenterology and co-founding the National Medicare Career Advisory Committee. His involvement in guideline development for colorectal cancer screening, as well as his contribution to Centers for Disease Control's task force on quality colonoscopy, highlight his profound impact on patient care and policy and healthcare policy. Among his many accolades, Dr. Johnson has been honored with Master of American College of Gastroenterology and Master of the American College of Physicians. And he has been recognized as ACG's recognized with American College of Gastroenterology's highest awards for his contributions to clinical gastroenterology. He has been a distinguished invited lecturer at prestigious events across the country. Beyond his research and clinical work, Dr. Johnson has dedicated much of his career to mentorship, guiding medical students, residents, many of whom have co-authored publications with him. His leadership extends to community service, having served on various boards, including the Norfolk Assembly and Norfolk Academy. Dr. Johnson's today's talk is related to his, actually comes out of his career as an academic faculty, mentoring countless students and residents and fellows throughout his career, and he's going to give us that talk. Please join me in welcoming Dr. David Johnson.
Thank you, Dr. Joan. And in particular, that description of my life, my wife calls program schizophrenia, so nothing psychologic about me, but I really just, sometimes it's great to have a partner that loves you and supports you through life. So anyway, that's how you get through those things. Today's discussion, I will disclaim, has nothing to do with being a gastroenterologist. What it does reflect is being in medicine for the last 48 years, and I define old by changing my definition by 1 year every year, but 48 years, and through that time, having an observational opportunity and privilege to work with people, learn from people, and change with people as you go forward. And today's discussion will reflect that 48 years, hopefully, of some wisdom and also some synthesis and best practices I can put together. When I talk about mentorship, it's a word. But what I want you to leave today with is an understanding that mentorship is really and should be a culture. It's something that unifies us, and it may not just be here in an academic institution, but as I'll conclude with, it also translates into things that we deal with, relationships, family, friends, etc. But nonetheless, I want to really make sure that we understand it's our job to be better mentors, however you define that. But inculcating that as a culture is really my goal today, if you will, the overall operational goal. And I call this breathing life into dreams, but how to be an effective mentor. I'm not perfect. I'm not the best. I just try hard. And really, that's what I want you to do as well. Set your goals to try hard. With this, I'm going to structure it around 7 principal goals or themes, and the first of which is, what do mentors do? And it's really talking about matters of skill. Operationally, what does that mean? Second is the traits of excellence. What do really mentors do as far as style and presentation? How do they communicate well? And looking forward to expanding what they perceive, but how they can share. Very important. The third goal is to talk about how we arrange our mentorship or a mentee relationship. So how do we begin? How do we choose our mentor? How do we develop our mentorship and walk with you through the course of that relationship? There's not a day or a minute that goes by that you don't have some opportunity to now appreciate diversity. And humans are different. And how we integrate some of this diversity into our relationships and how it matters in our development of mentorship really is important. We'll talk about that. Also very important to begin by rule number 1, know thyself, matters of integrity. Begin by the confidence that you know yourself, where you want to be, and how you explain that internally before you perceive that to somebody else in marching through a relationship of mentorship. Everybody makes mistakes. My wife tells me I do that all the time, but when things go wrong, how do we deal with that when we're a mentor? We're not a boss. Perhaps we could be superseding in supervisory relationship, but we're not that individual's absolute boss. And so how do we fix it? How do we restore that? How do we move forward from that? We'll talk about that. And finally, the last of the 7 goals is to talk about welcoming change. Not everything lasts forever. We develop, we mature, and we move on. It's kind of like our families. When we grow up and leave our parents, we move on. We still keep relationships, but it's a different relationship. And how do you close out? Maybe begin on new goals and directives for that expansion, but nonetheless bring closure to what the primary development path was for mentorship. If I put in perspective, you hear the word mentor. Well, what's the history? Where did that word come from? Well, it actually comes from Homer's epic, The Odyssey, where mentor was an Ithacan noble, trusted friend of Odysseus, and he was charged during the Trojan War for caring for the son of the caring son Telemachus, and that was mentor's job. And later in the poem, the goddess Athena emerges, and she assumes mentor's form, and she now becomes the guide, the protector, and the teacher for Telemachus. And in this role, she served basically as a coach, a teacher, a guardian, a protector, and a kindly guide. What does that mean? Well, foundationally, it's what the term mentor really means. And that's the development of that whole axiom of mentoring. So what do mentors do? A matter of skill. That mentors unearth the dream. So what I'm looking at as an individual, I may not know as an individual. I've got to relationally understand that and develop that. Michelangelo, the brilliant sculptor and incredible artist, used to approach a block of marble as a hunk, but it contained figures. He knew right away what that figure was, and that figure was merely there waiting to be liberated. So with each excavation of the marble, the figure became more alive. Michelangelo saw that figure independent of the hunk of marble that he started with. Now, there are some caveats in the matter of skill. First of all, there are no shortcuts. Nothing is simple in life, or should be so simple that you can always take a shortcut. And discernment, or the ability to judge appropriately, takes time. And affirmation takes time. So again, things we learn, we have to be patient. Affirmation and discernment take time. It's critically important to recognize that humility and modesty are required. Some of the most brilliant gastroenterologists I've had as mentors in my field, operationally as gastroenterologists and as leaders in societies. And I could sit next to them, and you could sit next to them in a bus stop, and they'd be the most down-to-earth conversational person. You would not know that this was the world's leader on some particular thing in gastroenterology. And the same if I sat next to him, not in present time, but as a student or a resident, and I sat next to him in a GI Society national meeting. They would be the most humble and conversational, engaging person, because they had self-confidence. See, humility and modesty are really required as a mentor, not to impose, I think this is what you need to be, but really understanding by knowing and developing, knowing who you are and calling forth that figure in the sculpture, if you will, what lies within. There are traits of excellence that I think are really critical for effective mentorship. One is to exude warmth. You've got to be a personable, engaging person to really get trust. You have to be able to endear yourself because that starts to get trust. It starts to build relationships. And warmth and caring is the most important of these traits. Patience, this is the way patients judge us. They view us as doctors, but they view us as trustworthy doctors, perhaps even more so when you're warm and caring. And it doesn't necessarily always reflect how you say something, but how you make them feel. And that's really, really important. It's always important to be available and more particularly to be dependable. I said I'm going to be there, and it's not, I said I was going to be there, but you can count I'm going to be there. Talk is cheap. We need to be dependable and we need to be available. We also need to be trustworthy. Remember the moral fiber, critical of oneself. Integrity has to upstand really everything that we build on, right? It has to be part of you. And that's the trunk from where the limbs of all these other aspects of mentorship begin. And we're not just talking about a relationship that is me talking to an individual or me talking to a group of you as mentors. We have to talk about, I want to build from what I learned from you as well. So it's a bi-directional chemistry. I want to learn from you because I can get better. I know I can get better. I can learn a lot from you. So again, it's bi-directional. It's a reciprocal type relationship. And it's important to understand that going into any of these mentoring environments. One that's really important, is critically important, is to listen actively. I have to confess, and that this is real from the literature, that data on men struggle more than women. I don't quite believe this. My wife tells me this all the time. She says there are two things that I can't tell you, but you really do incorrectly. One is, she says, you never listen to me. And the second is, I don't remember what she said, but anyway, that concept is we really need to look at that this is not a chauvinistic statement, but it's just data driven. And men tend, again, not chauvinistic, but data driven, tend to focus on instant resolving a problem. I see it. I've got a hammer. You got a nail. Let's fix it. Let's do it. And again, that's not what mentors really need. What they need is a synthesis. They need time. They need a listening ear. They need to develop over time how that relationship's going to evolve. So again, we have to put this in perspective. And mentorship as a mentor doesn't mean that I'm the right answer for everything. So when we start to look at mentorship, immediately I'm starting to build into how can I make this a partnership? And it may just not be me as a skill set that you need. I'm not a Superman. My wife will definitely tell you that. But a Superwoman, again, we're not everything for everybody. It's more building a constellation. You can be a star in the sky, but it's the constellation around you that makes you the universe. And we can make much more sense as operationally being a universe than an individual that's being the mentor. If we look at traits of excellence, one of the things that I alluded to earlier is you've got to embody humility. People will come up to you and people will trust you much more rather than be intimidated by, well, that's the expert. I really can't talk to him because what he says or she says, if I say something, they're going to think I'm stupid and I really am not that level of status. I really shouldn't be around them. We've got to be as humble as we can be engaging. And you certainly have some responsibility to this. You respect values. This respect comes across ethical values, moral values, and societal. And I would translate this into a more extended, transcends things like religion, relationship history. It may be personal, it may be political. All those things really have to be independent of your mentorship. And certainly sexual orientation or private career aspirations. This is what I want to do. Again, operationally, it may be important to understand them, but it's something that we disrespect as far as a value in our relationship with our mentor or our mentee. Critical to trust is privacy, because as you get more and more endeared, you may learn more and more about the individual. And they may be very private things that do not need to be shared. And they can determine if they say, I'd love for you to share this secret or this bit of information, which is quite personal to me, but feel free to share it with the team, because I think it would come better from you rather than me, perhaps. And again, these are things that privacy matters, and they determine when, where, and what. Rules of engagement is give respect and be extremely sensitive to these are personal topics, and these are topics to be shared, and not share it if it's irrelevant for work. You're talking to somebody during the Thanksgiving holiday and you say, can you believe that David Johnson actually roots for UVA against Virginia Tech in that game? That is that's really not anything you need to be shared. It didn't prove anything to anybody, but it may have given some condescending implication to me. Again, if you root for UVA, you learn to lose, but anyway, in football. But anyway, the concept is this is something that doesn't need to be shared. It's irrelevant. It may be if I tell people that, that's my job. One of the things that is really important, and I'm not going to ask you to raise your hand, have you ever made a mistake? Duh. Well, what do you do? Well, you learn from that. And if the job was to be the best and you start at a starting entry, you're not going to get there at being that, because it takes time. It takes judgment, all these things, and it's gradual. So again, when it's appropriate, you start to look at affirmation. We don't start with the giant steps. We start with baby steps. We don't start teaching children how to ride a two-wheeler without training wheels. We start with training wheels. Things begin with approximation. And that's what becomes important when you develop a trust and a mentorship, because you're giving them feedback when it's a tangible positive. That was great. I'm so proud of the way you did that. And that's your first step into this. I think you did a fantastic job. What do you learn from? You learn from mistakes. Now, a big mistake is not to learn what you did wrong the last time, but really learning is based on making a mistake. Being positive on those mistakes in baby steps is really a key element of what's called successive approximation. So promote excellence. I always love to begin a conversation where I talk to somebody and I really am going to have ultimately some negative thing to say, but I say in a very positive way, boy, I really can't tell you how much we appreciate how hard you work. A positive leads into a little bit more of a subliminal negative and criticism perhaps, but you're promoting excellence and you're rejecting perfectionists. I know you made a mistake. It's not perfect. Everybody makes mistakes. We're not perfect, but we're learning along the journey of what we go through, and that's why we're working together. B.F. Skinner, the behaviorist and famous psychologist, used this this principle of approximation to teach pigeons to play ping pong. I play ping pong pretty well, and hopefully I don't have some background if they did my DNA check that I was related to a pigeon somewhere, but nonetheless, that's what he did, successive approximation. It depends on the mentee and the context for sure. You want to tailor the assignment so you know that they're going to make that performance non-frustrating, but challenging enough that they're going to move forward. And you have the right challenge for them. And if they have some break in that, you have some ability to manage their anxiety. People get anxious when they make mistakes. But regardless of what happens, we learn from those mistakes. And you have to bridge that anxiety to say, okay, now we've got another foundation and we can move forward. Got a better view. Can see a little bit over the horizon. Here's where we're going. And you challenge yourself, and I'm proud of what you did. Clearly, punishment is not a great way to mentor. Unintended consequences are maybe the mentee doesn't want to take on a challenge anymore. Maybe they become more in a shell. They become more introverted. They don't talk to you as well. They don't apply themselves as well. So negative consequences. It's a carrot and the stick phenomena, right? You learn better when there's some pro thing rather than negative. And if you wait until they get and master that ultimate challenge, that's unwise. Again, baby steps, sense of approximation. This is what we really are looking for, and reinforce the success of approximation. You're doing a great job. You're moving in the right direction. We're continuing to learn, and I'm proud of what you're doing. But how do you begin a mentorship? You don't just sign up on eBay or whatever the social media and say, mentor wanted. what you want to do, and they may come to you or you may come to them. Particularly what you want to do, though, is you're not the right person for everybody. And oil and water don't necessarily mix. So you have to look at somewhat in a discerning way, really what matters. And I call it the matters of chemistry. And things that really drive this are things like personality, social skills, how they communicate. Are they engaging? What are their personal values, integrity, those things that really drive what I would want to see if I was going to be working with somebody. And I'm going to put time and effort. I really want to have some shared values as we build on this, and looking at short-term and long-term career. How am I operationally going to integrate with you? And where's the best match for you? And perhaps it may not be with me. If I put this into a teaching point, a key point, I'd call it a salient cluster of the matching variables. I think it begins with work ethic, the need for achievement, somebody that wants to grow. How they grow is somewhat indeterminate at the point, but they want to grow. And really, instinctively, they've got drive, they've got grit and a commitment, somebody that is going to work hard. I'd much rather have a smart person working with me that is working really hard than a super smart person that rests on their laurels and is going to say, well, I kind of know that. Hard work trumps super smart in my book from 48 years of experience. The more similar these all overlap, the greater perceived benefits. You as a mentor and the mentee working with you. It's a building relationship. You pick your friends. You don't necessarily pick your family, but you do pick the people around you. And this perceived overlap is one thing that drives mentorship success. How do you choose your mentees? Well, you might be the brightest and best, the fast trackers. It'd be easy to say, you're really a superstar. I want you to work with me. That's not always the case. Sometimes I think, again, when I come back to, I'd much rather have the hard worker that has integrity and the shared values and things rather than maybe the superstar. Maybe they are a superstar and to have all those things. That's great. But that isn't necessarily the deal breaker. It's the patience, it's the development of people that working with you and their traits that I would aspire could really supersede this fast tracker label. Honesty, communication skills, personality, emotional stability. These are things that you're going to developmentally work with, but you really need these as you begin the foundational relationship. Adding to that would include enthusiasm, initiative, intelligence, sure, that's part of it, integrity. None of these are in any particular order, but I think they're really critical and cardinals that I would say can supersede the fast tracker, if you will, going forward. Now, there are elements of diversity in the world. We see it growing even more every day. We see things like diversity, but it's important to understand we're all privileged to have eyes and ears, so we see and we hear, but we may judge based on that. And we can judge based on cultural or racial or gender or orientation. That's a box to check. We need to be synthesizers as to really what is the individual, what's under the hood, if you will. So we're putting these into the diversity, recognizing, but we're judging not what we see or hear. We're integrative on our assessment as we look at the individual as a whole person. And this is increasingly important because the global community as a world is ever more diverse. Cultural diversity is more commonplace. The world changes, but we need to then take that as foundational moving forward and approach the possibilities. How do we work together? With these things being said, it's not me, but I can work with that, and I love to learn from that. And again, promote that in our relationship. A caveat is to avoid bringing it up. So I hear you're a Republican or a Democrat, whatever your political. I use that just as a term in the present day. But I'm not going to bring that up because it may be a flashpoint. And those are things that are really not important, but I'm going to broach it. If you bring it up, we can discuss it. But if I bring it up, it may provoke anxiety, it may close this whole relationship. And again, I'm going to approach this very fairly. I'm building a foundational relationship, and that's really structurally critically important. So a hallmark of an effective mentor is the capacity to see, to look beyond that block of marble, if you will, Michelangelo seeing sculptures, and really individually appreciate the mentee rather than the representative. Oh, you're a Democrat or Republican. use that term pejoratively, but nonetheless, the categorization of the individual rather than the understanding of the true perception of the individual as a whole. Now, some caveats that I would give you as far as mentorship. One is encouragement and support. You might say encouragement and support are very easy to give. You did a great job. But sometimes that's not so easy to do. Maybe you didn't do really a great job. You did an okay job. But again, we come back to that sense of approximation, baby steps. Maybe it's not my skill set to be a positive response to your every action. And I'm maybe not culturally or the way that we grew up, maybe we didn't hear that a lot. So the skill set may be a little bit difficult for some people to learn. The greatest struggle may be when the mentee who's super bright and self-confident, remember that fast tracker that we talked about, because it may be that you start to give them a little bit of extra confidence when maybe they're not quite there. What we want to do as a mentor is nurture creativity, but temper that with the idea of idealism or dreamful expansiveness. Wouldn't it be wonderful if we could do this and the pie in the sky thing? Bring it back to reality and pervasively ground it with judgment as you give. And I've learned this, as I call the wisdom of experience and the discipline of reality. So we have to bring these two as cardinal principles when we start to look at mentorship and encouragement. Now, we talked about behavioral changes that Skinner derived in ping pong as it relates to pigeons and changing that with baby steps. But it's reinforcement. This is progressive approximation, which really drives the individual to have some integrity and build of their structure and their own self-respect. Increasing this by successive approximation is a cardinal rule that I would leave you with that is very, very engaging. Now, recognize every mentee is different. You can't make a one shoe fits all. We don't all have the shoe size, so we don't want to wear the same clothes size. I don't put that into the individual mentee either, regardless if it's a category that they may be a male or female, or they may be a Republican or Democrat. Again, these categories that become superfluous when we start to talk about understanding the individual. But in the importance of assessing the mentee differently and who they are is critical if I'm going to be the mentor to bring those sculptures to life as we start to talk about carving on the marble. Recognize, too, there are limitations. We're not able to help all problems, and we have to build on that. We can't successfully engage in a relationship if we're the star in the sky without the network around us. Perhaps there may be other things and other people that can build on this mentorship potential. One of the benefits as a mentor is likely you see increased productivity. You have people working with you. They may work in your lab. They may work on your service, whatever. You may be more productive in your FTEs or whatever your judgment of your own success in what you're trying to challenge. But increased productivity is one thing that you may see. You may have some recognition that you're gaining as a reputation for being a mentor. People may talk about you. Promotions committee we've served on for, I can't remember, in the internal medicine since I've been here, and the institutional board for 15 years. But we've talked about mentorship when we talk about promotion, going from rank order and looking at what the accomplishments of the individual. Mentoring is a very, very important career aspiration. Doesn't mean that you necessarily have to publish 15 papers, but maybe you're an appropriate mentor for key individuals and medical students and learners. And that becomes a really cardinal principle of what your success in the institution. And as we evaluate you for progression in rank, that becomes a key element of recognition. Academic advancement, as I say, is something here we can talk about. But as you go out and work on things that are in your family, or you go out and work in things where you're on the service and you're a resident or you're a student, it doesn't really matter in rank, but it matters in how you build that relationship that you can mentor people going forward. It's a real satisfaction, isn't it? When you work with somebody and you see some advance, you get a self-fulfillment. It's not all about us. The joy of watching that, though, is great. I love making people happy. I love watching them become happy. And that's really a personal thing, but it's not the driving thing. But nonetheless, it's a true benefit as being an effective mentor. But the contrary is you can have that Damocles fall the wrong way. The mentee fails, or they stumble, or they do something incorrectly. Maybe guilt by association. Oh, he worked with Johnson or she worked with Johnson, and your name goes down with that. It may be my self-perception of maybe I didn't do the right thing. I didn't work hard enough to be part of a great mentor. My own integrity of how I value myself may go down. So there are some downsides as it relates to mentorship and perceptions. And there are risks, obviously, that go with time, right? We're all on a time schedule that becomes increasingly more difficult, from family and job related, all these things. And the commitment of time has become much more challenging for so many of us. And certainly that is a potential risk that we recognize. And we have to understand that we're willing to do that. You may not say, I'm going to commit 90 minutes in a given day, but I'm going to be in a willingness to be flexible. And I may not be able to do it today, but I may be able to do it tomorrow or whatever. But the commitment of time is one thing that can need to be recognized. Now, when things go wrong, first of all, tell the truth. I did it incorrectly as your mentor, or, this is an error. I just want to work with you on this. This is really, again, we're making a mistake, but we're learning from that, making it positive. But tell the truth. Don't ignore it. You've got to be in a bi-directional relationship. Tell the truth and explain that. Take the lead on this. Don't wait for the mentee to figure it out and come up to you and say, Dr. Johnson, I made a mistake last week. The self-degradation in that point becomes really, you probably knew this. And I'm not going to say, I knew that last week. I was waiting for you to come to me. I'd rather pull you aside in a very judgmentally neutral way and say, listen, I just need to talk to you for a little bit. Let's just do this confidentially and separately. So don't avoid constant communication. Don't run from the fire. Maybe just go put a little bit of arms around and really sit down and have a heart-to-heart. And let's look at this together. And if the mentee is stumbling, don't wait for them to stumble. Alert them. Say, hey, we're working here, and there's some things I can see that we can, I call it pushing the stone. Let's do this a little bit differently. Let's do it in a positive sense. But again, alerting them rather than waiting for them to fail. Be directive and constructive and give them positives. Again, positives is the way we begin, and then we tell them the rest of the story in a constructive way. And it's regular feedback, periodic meetings, and things that are going on. I still meet with my mentees at the annual meetings that are out in training in different institutions, and I typically will get together for a lunch somewhere. We'll talk about what's good for you and what's your goal, what's changing, how are you structurally working, and what can I help with. But lead with positives when you have these relationship conversations. Again, feedback sessions, structure, and really important to keep them regularly. And we're not the best at everything. So if something is going awry and I can't fix it, somebody's got an emotional issue I can't fix, they've got a marital issue I can't fix, you need consultation or recommending consultation. I can't do it for you, but I know there's some people that really are part of that constellation of the universe we talked about, bridging out and looking at experts and people that will be perfect for you. And I can help you with that, or I can help myself with that. If I'm struggling about something, I need help. I need to do that myself. And again, if it's a trainee or somebody in a business or whatever your mentorship relationship, if you need to really put this down, document it. It's really important. It doesn't have to be public knowledge, but it may have to be professionally documented just by the rules of structure and organizations that we deal with. It's just the rules of what we do. Now, most of you know me fairly well. Some of you know me incredibly well, but I love to use humor in my conversations. But embracing humor can really diminish anxiety. So when I start to talk to somebody, I frequently will open with some type of euphemism that makes the people laugh, makes people feel like they can take a laugh with me. They can now have a conversation with me because I've brought myself to the level of conversation, and humor can work very well and certainly diminish anxiety. That's funny that you did that. And reminds me of a story and you broach that and take that anxiety away. And I tell people, everyone's blown it. Everyone makes mistakes. I told you, ask my wife. Here's her number. Call her. She'll pick up. If she's going to have the opportunity to tell us that. But nonetheless, that's the way we learn. But don't belittle that by humor. Like, Dr. Johnson, he made such a dumb mistake. You just can't teach stupid. Now, I've said that about other things in life jokingly, but that's so demeaning in a way that is to the individual. So again, humor there would be disrespectful, and I think it'd be unconscionable to have that type of conversation with anybody. So used inappropriately, it's actually counterproductive. If I'd heard somebody say that about me and I'd been really in a problem and I heard somebody was joking me out on that, or I said that to that individual, be counterproductive. They'd really shell down and they would really view that as harmful. I think it may be really a degrading relationship from there going forward. The mentor should never belittle the individual, either in public or the individual directly. Now, despite the intent for humor, recognize that cultural differences are out there, personality differences are out there, and some mentees may have little capacity for humor. I will tell you a personal story of doing one of the first talks I did when I came to Norfolk. I was invited to speak at the Library Guild in Virginia Beach. Now, I'm not a big cat fancier, and I loved Gary Larson. Those of you that are old enough to remember Gary Larson, and he didn't particularly like cats. So I had a couple cat jokes in my lecture, and I think I was talking about colon cancer screening or something common. And I had this one slide that had the dogs with the door open and a cat in the road, and they're coming around a corner. It says, the Gary Larson cartoon says at the bottom, Rusty, 2 points. And I looked up and I thought it was pretty funny. Nobody was laughing. And I looked up again, and the reason nobody was laughing was they all had gray or silver hair. These were 70 and 80-year-old women. And guess what they have at home? And 3 slides later, one of the slides, and I used the humor to reinstate what my teaching point was or my message. 3 slides later, the slide came up, and 2 women are sitting there, grandmother type, knitting on the sofa, and the cat's laying on the ground like this with his tongue out like this. And the woman saying to the other woman, after that episode with the drapes, we decided to have Muffy debrained. And I was dead in the water. So humor there was devastating, and I couldn't crawl out of that place fast enough. So some respond poorly to humor. Recognize your audience, know your individual, and the culture around that may be important. So again, read mentees, and humor may be, you're having a great day, maybe we can use humor because you're in a good mood, you're having the right thing going. If you're down and out and you've really got something struggling, I'm not going to bridge that with a humor to broach that individual, and particularly when they're receptive, if you can use the correct interpretation of the individual in the right time. So how do mentors fail? One of the things is you set expectations too low. We don't have, growing up, get to kindergarten and say, I hope you make it to 2nd grade. We want to say, let's get, we got a lot of things to learn in life, right? We got a lot of times to get there. But you don't want to set the threshold too low because you undermine the ability's potential. They may think, that's as far as I can get. Or dumb it down, that's as hard as I'm going to try. Potential, it really needs to be appropriate, and the bridge going forward needs to be high enough, but still reachable. If you fail to challenge an individual, although you may try to be caring and say, I don't want you to work too hard, it may actually be destruction as it relates to the achievement of the individual. So despite caring intentions, may be just the opposite. So I say setting modest requirements, to my mind, promotes pervasive mediocrity. We have a regression to the norm, the mean. That's not where we're working if we're working with a mentor. I want to work with you, again, remember I said have drive, have grit, willingness to move forward. That's what's setting our relationship at the core. And certainly, I alluded to negative comments. So a mentorship can really run awry if you make stringent demands on perfection. And again, I can make those, I would say not demands, but I can directionally help you in guiding But if I don't provide the equipment, if you're a lab person, you don't have the personnel, the provisions for the journey, if you will, the ways that you're going to be sustained as you move forward, because there may be operational costs, there may be operational time commitments and things that going forward, if I don't provide those or structure some way to bring them up and help you to learn how to provide those for yourself, again, this may be a failure in the long run. And setting expectations, I think I want to have this done by Tuesday. It may be okay if you're a deadline on a manuscript draft that is relative, but when you're setting career goals on mentoring, you set the goal intentionally or not, there may be an understanding by the individual that you're setting something that may be unattainable. And this, again, may be self-destructive in your relationship. And again, demands for perfection or flawlessness really sabotage really the well-meaning of what you're trying to aspire when you develop a mentorship. It's important too, as I said, we ultimately grow up in our families and we leave our parents, we leave our jobs and move on to other things. But matters of closure are also important when we start to broach how do we sanctify what we've done and close the loop here, and separation and redefinition perhaps. So you're leaving this stage. I won't be there every day for you, but this is where I think we need to continue, or the mentee says that, or let's keep in touch and developmentally, how do we move forward together, but on a different plateau and a different trajectory. An effective way to close this is to sit down and schedule a formal time to process. Let's go over what you did. Let's celebrate together and let's reaffirm. Let's start by telling stories. You remember when we first met? I remember one of the individuals here who was one of my mentees. I met him when he was almost just after he was born. That's a funny story. I'm not going to point out who he is in the room, but nonetheless, it's something that, it starts with the beginning. And I remember when you did this and milestones. I remember when you made your first presentation and the highlights of those things. Again, those things really are a great way of closing out that chapter or the chapters of the individual relationship. And acknowledge too what you've received. Remember I said mentorship is a bidirectional relationship. I want to grow with you and I want to learn from you. And there are intangible things that you've done for me. I feel like I'm a better person. I'm a better synthesizer for things that I wasn't aware of. Operationally, I'm more structured in my own integrity because of lessons I've learned from you. I can point those out perhaps. If you have something that's specific, that's a great thing to do. But you're closing and solidifying that relationship, not necessarily at the finish, but from the start to that present matter and time. Now, I've given you all these things about mentorship. I'm going to close with what makes an outstanding mentor. So when we talked about rules of excellence, how do we make excellent better? I did also aspire that this is not just about mentorship, but it's about life. And mentorship, you have to have intent to do this. You want to work with people, you have intent to teach, not necessarily an academic, but lessons learned from life or whatever you're doing. Mentorship has to be intentional. It just doesn't happen. It also doesn't happen that you just were assigned somebody to work with. It's got to be a thought process. We talked about chemistry. We talked about oil and water. They don't necessarily mix. We talked about disparities across the world of diversity. But understanding all those things may actually solidify the individual as you select your mentee thoughtfully. The investment. Time is cheap, but it's also time. And it requires time and energy. So not only am I going to give you the time, but I need to support that with the energy, the enthusiasm, the support, the elements of tools around that time and energy to make this successful. The model of humility, as I said, I'm just had the privilege of working truly with some of the best in the world in my field as I grew in the field of gastroenterology, and they did so much for me, but they were, again, the person on the bench next to you at the bus stop. You'd never know it. They never told you what they were doing every day. They didn't tell you what their latest accomplishment was. And again, that humility drives incredible, genuine relationships. And you have to deliberately be active in this and offering career advice, support functions around mentorship, because that's what they're there to learn. They're learning life lessons. They're learning about integral things in a potential area that you may be a skill set that they otherwise wouldn't achieve. So again, offering that is part of a successful mentor that's outstanding. And with that, I put together a two-part way to do that. It's the wisdom of experience with the discipline and reality. So again, 48 years of experience, but I've made a lot of mistakes and a lot of things that we do differently. But I've learned from that. And the reality of how we put that together is really how to be a most effective mentor. So what I leave you with today is I don't care necessarily in a negative way, meaning about you. It's not my goal here to just say this is a lecture on mentorship. This is a lecture about culture. And I don't care if you're at the beginning of your career. You've learned from people, you've observed people. You can do this to more people. But culturally, we need to develop ourselves. That's the way the field and that's the way the world grows better. The more we can do that, the more we can, again, go back and learn from our mistakes, the more we can move forward from those things. But it becomes a responsibility of culture that defines how we pass this on, and that really defines the legacy, be it a culture in internal medicine or whatever your fellowships or residencies are, or your family relationships, your friendships are. It's a legacy of how we can pass that information and teach others or work with others and learn back and forth from others. But again, it becomes legacy. So if I gave you the conclusion about mentorship, the take-home messages, if you fell asleep and you're just now waking up, I give you a couple things. One is honesty. Remember, the first thing is be true to yourself. Warmth, endearing trust. That's the way that you start with a relationship. People trust you. They like you. Patience, the same way. And again, honesty. Availability and reliability. Remember, time is cheap. Don't just say you're going to be there. They know you're going to be there. And you're going to be available for what comes and how things need to be perceived. You'll have insight for how you go forward in time management. I can't necessarily say I'm going to set 90 minutes a day today for the rest of the week, but I'm going to manage my time. And I have this in my mind that I'm going to commit to that individual and I'm going to stand by that commitment. But time management is really important. Hopefully you recognize there are incredible benefits. There are some relative risks as we talk about mentorship, but mentors need to understand that. And they need to build a relationship around that. And things start to go awry, we talk about how you can mitigate around those mistakes or those things, and culturally how you make this a success out of a potential failure. And structure and commitment. I'm going to stay with you. We're going to work on this. If it's not working, we're going to not continue on this, but I'm going to be here for you. And you can trust me and you can rely on me. And we're going to continue this as it takes time. It's going to take journey over time. And we're going to do this with approximation, not with absolute leap steps. It has to be unbiased. We talked about the diversity issues, and with integrity, your moral culture has to be the center of all these relationships. That they know who you are, they know they can trust you, and you stand by really what you say you are. And the skills to inculcate this is what I come back to as mentorship. We've got to really take this forward, not just for an academic career or an academic training, but taking it to life. It relates to your families, it relates to your friendships, it relates to business, the things that you may be interactive with. It's a cultural thing. It's not just a mentorship thing. It's a way of life. I love this quote. This is a Hispanic media monger that has said this, which I thought was quite funny. They're mentor levels, not funny, but mentor levels. And you talk about mentorship 101. A mediocre mentor tells. Move up to level 2. What's a good mentor? Well, a good mentor explains. Well, this is the way that's the reason, the pathophysiology of what that was. And the superior mentor demonstrates. I'll show you what we need to do. That's how you work through levels of mentorship. But when you get to a great mentor, they inspire. With that, I want to leave you with 3 parting thoughts. One is mentoring requires you to have a lot of wisdom. And from your experience, I don't care if you're 18 or you're 70. Raise your hand if you're that old. Mike, you can't do that. The concept is that it requires a lot of wisdom, and you learn from experience, and you look for people to show you the way. And I love this because it says, patient grasshopper, let the mailman come to you. Again, directional experience from people that are more perhaps vested in that space and with that time. For all the directional things that I've given you today, I came across this just the other day for the travesties of Hurricane Helene and the incredible devastation that it's done, and all those in the path of the current hurricane yet to come, Milton. This one I really caught my eye is you've got to have the right people directing you. And this was a shot from one of the flood zones that I thought it just broke my heart, and it just engendered so much warmth. But the right leadership will get you in the right direction. And ultimately that's the challenge of life. With that, I'll leave you that mentorship has to be the right person. You choose the right person, or maybe you are the right person. But selection matters. Privileged to share this with you today, and I'd be happy to take any questions.
Questions? So while everyone is thinking about questions, maybe I'll ask. There's this somewhat more recent phenomenon about speed mentoring, and I was wondering what your thoughts are on that, because that's just a very short duration of relationship.
Yeah, I haven't really read that, but the concept is you've got a consolidated time, and you have to work with what you got. You can't fix everything in a certain timeline, and I think that becomes foundational. You're here for a certain number of time. Here's the opportunity. Let's set some goals, but make them approachable. And maybe we set our goals to build on when that speed mentorship comes to closure. Remember, we talked about matters of closure. And when we get to that level, maybe we'll continue to work. But let's start with success. Let's get to where we can both have confidence that this is going to be integral to you and it's going to be important to you as a mentee.
Other questions?
I did this discussion at NYU a couple months ago, and one of the questions to me was, what books would you recommend? And I read this great book a couple years it came out. Again, these are things that we're not taught, right? We learn from operationally observing or potentially reading. And one of the great books on mentorship, if you want to find one, I found this really inspirational, was a book by Johnson and Bradley called Effective Mentorship. I can't remember who published it. It was a couple years ago it came out. And if anybody needs to get the specifics on it, just send me an email and I'll be happy to give you the exact, but it's the Effective Mentorship. And it was one book that I really found I learned incredibly more than I knew. And that's kind of how you grow in life, I guess.
Thank you for the talk. I guess a couple of questions, if you don't mind. One is, I find it difficult at times to differentiate mentorship from coaching and championing, and there's overlap, and maybe I'm having an existential problem with it. But where do you stop, and is it okay to do all three at times? So that's one. And then I wanted to get perspective. Have you had several mentors at a time, or have you tended to go from one mentor, close that, go to another mentorship relationship? And what do you recommend in general?
Yeah, those are great questions. Thank you, Dr. Hahn. The first is about overarching directives. One is being a mentor, and the other is being a coach. And again, those are really definitionally meet the individual and the circumstance. So you're the attending on the internal medicine service, and you're the coach or the teacher. But the relationship that goes further than that is, I want to help you through this project or whatever. That becomes a little bit more of a jurisdiction that has a different zip code, if you will. And the overarching coach doesn't have that intimacy and relationship and really define roles outside of what may be in a very public way what you're doing. And maybe you can do it a little bit more in a coaching way on a personal level too, but maybe not with the same expectations from the mentee or the coach, the student or the coachee. That's a word. So that's the way I would direct that. The second is whether or not you have more than one mentor. And I think that the simple for me is it depends on what you want to achieve. So if I wanted to achieve something as a mentee and I was just beginning, I would suggest you start with one mentor because you really want to learn the whole process, right? And pick the right one as we talked about. But as you get more vested in whatever you're progressing in, you may need somebody. So I may need a mentee in molecular genetics, a mentor in molecular genetics because I'm not an expert in molecular genetics, and I work with that individual on projects, and maybe just structurally that's things that I need to divest. Remember, I said the star in the sky is not the super person for everybody. It's the constellation in the universe that makes it the really effective perception. So I think that as you mature in whatever you're trying to aspire to, selectively you can bridge different mentors, and it may be different levels of mentorship. I mean, the all in or this is where I need you, and this is what I don't do well, and this is where my mentor and the mentor will say that or should say that. I really don't have a skill set on that. Let's work with Dr. Tahan, because he's really an expert on this. And that same bridge of handoff is really implicit on the mentor's job as much as the mentee, recognizing what you really can do and achieve.
Other questions? I'm wondering how you have dealt with or you would deal with a situation where you were expecting a good mentor-mentee relationship, but soon you realize it's not working out. And how do you create that separation? I do see that you had that parting apart, which seemed like more relevant to at the end of that mentor-mentee relationship when mentee is moving to the next phase in career or life. But how do you move away, or how do you address that situation where you realize it's not working out? I need someone else, or this person needs someone else.
Yeah. So again, matters of closure is one thing when you've gone through that relationship, but the matters of failure when things are not working. Again, we talked about periodic feedback and regular meetings and documentation if you need to in that regard. But things that you don't wait for them to fail, but you recognize that you're directionally not going there, and is there something you can structurally, relationship-wise, change that may provide them a better opportunity to succeed in which way they're aberrant. But recognizing if it's not working, you have to close it, because the failure of the mentee can reflect on you. Can reflect on them and their integrity. They devalue perhaps. So you can structurally change a lot of things around that. And I always like to discuss things that I know I'm going to say in a negative way, ultimately in a nice way, but begin by positives. Boy, you've been great. Your enthusiasm, your attention, it always is great to see you here every day. But there are some things that I think directionally we're missing a bit here, and we just need to talk. I incredibly respect what you do. I know you're going to succeed, but we need to move on from this, and let's do it together. And let's not sever a relationship, but let's change our relationship. So again, in a broaching way that neither people it's not scorched earth, in other words. But that would just be the way I would kind of approach it.
Thank you very much. All right. I see it's 1:00. Thank you, Dr. Johnson, very much for that.